to just cross over to the Intercontinental. I understand that there's an event there. World Pneumonia Day is being marked today. Let's just cross over there and listen into a bit of what's happening.
500 million Kenya shillings over the next 2 years to support this work. And Dr. Sheikh, Dr. Cheruchich, please chase me when you see me leave this room, and I'll tell you how we're going to spend that money and the things that we could do together to make that work. So again, thank you very much, everybody. It's nice to see everybody here. Let's go out there and do this and do a good job of it and hammer those indicators downwards. The next meeting we have here, we should be saying we should be ticking the box that we've actually achieved those indicators. But more than that, and I'd like to echo my colleague from Save the Children here that we need to refresh that plan once more. I think we're in a new MTP phase now, 2018 to 2022. There's no reason why we shouldn't refresh our CAPD strategy, our CAPD plan, to include all the new things that we've seen happen over time. So thank you very much.
Gerald. Thank you, Gerald. Gerald sometimes talks so dearly, because I know we used to work with him until 1 o'clock, and what he's saying, he means it. So 500 million, he's not lying. When he says it live, I know he does it. So clap for him. Now, Gerald, I want to demystify your fear that we have health workers with us here today. Yeah, the counties are the ones who are implementing. And just to make you comfortable, let's call Nairobi County to come and welcome all of us as a health worker for Nairobi before we proceed. So Leah Rotich, you can represent the counties. Come in front and say something.
Good morning, everyone. My name is Leah Ruto. Working in Nairobi County, I coordinate child health. All protocols observed. On behalf of the County Director of Nairobi County, I wish to welcome all of you into Nairobi County. Being the host, we are very proud having you here. And as Nairobi, we are also among the affected counties concerning pneumonia management. And we are very grateful to the national level, our partners, for taking this initiative concerning our children, because we know that these children are the leaders of tomorrow. So with those few remarks, I wish to welcome you to Nairobi County. Thank you.
Thank you, Leah, for welcoming us, Nairobi. And let's clap for Nairobi. This is our host. Now we'll continue with our partners, and this time I call upon UNICEF representative, Dr. Peter Okoth, to come and make your remarks.
Yeah, thank you, Kabaka. Dear colleagues, development partners who are here, first may I kindly accept the apologies of the UNICEF and WHO representatives who wished to be with you today to commemorate this important day, the 9th World Pneumonia Day. But I'm glad that amongst us we have present WHO, the focal point for child health and nutrition, Martin, yeah, and also other colleagues from UNICEF. This day is usually commemorated on the 12th of November every year, and it accords us an important opportunity to once again take stock of the gains made in meeting the rights of children to quality health care. Today, we specifically reflect on the progress we have made globally and in Kenya in ensuring children receive those interventions necessary to ensure no child falls ill or dies from pneumonia, a silent and leading killer of children. The theme for this year's World Pneumonia Day is Stop Pneumonia, Invest in Child Health, and Every Second Counts. This is a call for all of us to pull together to invest in strengthening the health system to deliver universal coverage for interventions that assure the survival and development of all children. Ladies and gentlemen, pneumonia is the single largest cause of death in children under 5, killing more than AIDS, malaria, tuberculosis, measles combined, as highlighted by the director of SAVE. In 2016, the world lost over 920,000 children under the year of 5 due to pneumonia. More than half of the deaths occur in developing countries, especially in regions where access to functional health facilities is limited. In Kenya, an estimated 11,000 deaths of children occurred in 2016, according to the WHO and UNICEF estimates, and this was due to pneumonia. It is estimated that every 30 seconds a child dies from pneumonia. Even as we reflect on the unfinished work of ensuring all children survive and thrive to their full potential, we should also celebrate the gains made over the years. Globally, an estimated 8.7 million pneumonia deaths have been averted between 2001 and 2015. In Kenya, the death of children due to pneumonia has progressively declined from around 19,000 to an estimation of 11,000 between 2012 and 2016. Reduction of child deaths due to pneumonia has been made possible because of improvements in exclusive breastfeeding. Those who have seen the statistics over the years, currently Kenya reporting around 61%. Previously, it was very, very low. Vaccination coverage against common childhood diseases has consistently improved since the year 2000. Access to more children are accessing safe drinking water, better sanitation, and we are having improvement in hygiene practices. There's evidence of reduction in indoor air pollution, and we all know that indoor air pollution causes around deaths due to pneumonia. We have also witnessed increased access to recommended treatment, and we are very glad that today we are formally launching amoxicillin dispersible tablets, which provides better treatment compliance amongst caregivers. And these achievements have largely been possible because of the strong government leadership and the engagement that we have seen taking place with communities. UNICEF and WHO specifically note with appreciation that in 2011, Kenya was among the first African countries to introduce the pneumococcal conjugate vaccine in its routine immunization program and has sustained its provision to caregivers in public health facilities at no cost. While we all acknowledge the strides made in Kenya towards reducing pneumonia infections among children, we must note that less than half of sick children access timely recommended treatment. An estimated 400,000 children remain unvaccinated. Exclusive breastfeeding is still lagging behind, while many more children are still exposed to indoor pollution. Majority of the unreached children live under challenging circumstances, as we saw in the play presented by the frontline health workers. The child was definitely comes from a poor background. The mother, limited access to health information, and decision-making at that level is delayed. We must focus on ensuring that every child counts. As Kenya commemorates this year's World Pneumonia Day and introduces amoxicillin DT, we would like to reaffirm our commitment as WHO and UNICEF to supporting efforts by the government in ensuring access to effective prevention and management of pneumonia. However, the achievement of meaningful progress will depend largely on the ability of all stakeholders to work together and build inclusive partnerships that address inequalities and promote dignity and prosperity for all people in Kenya. Similarly, more resources need to be allocated by government and partners to support and protect the gains already achieved in the fight against pneumonia. We must all stop pneumonia, invest in child health. Every second counts for every child. Thank you.
Thank you very much, UNICEF. Now I call upon NI to come and make your remarks.
All right, so that is what's happening at the Intercontinental. We are, of course, covering that World Pneumonia Day, which is being marked there by a section of players in the health sector. We'll be getting